workplace. Most importantly, all employees should continue practicing social distancing as much as possible and practice hand hygiene as often as possible. Businesses should disinfect surfaces frequently. At Grand Itasca, we expect everyone who enters the building to wear a homemade mask or a surgical mask, depending on their job duties. Staff wear a mask whenever they are in the building, with the exception of when they're eating or drinking during their meal break, or in an office space away from other staff. It is important to practice proper masking, which includes washing hands before and after putting on or taking off the mask, and wearing the mask above your nose to below your chin with no gapping on the sides. We've also eliminated the use of reusable cups at community coffee, water, or other beverage dispensers throughout our facility. You should actively encourage sick employees to stay home. If staff become sick, they should follow the CDC guidance for returning to work. If they meet current criteria for testing, they may be tested at Grand Itasca. Testing criteria currently includes persons with known exposure to confirmed cases of COVID-19 or a symptomatic employee with high-risk medical conditions or over the age of 65. If they receive a positive result, they should not go back to work until at least 10 days have passed since symptoms first appeared, and at least the last 3 days have passed since recovery. Recovery is defined as at least 3 days of resolution of fever without the use of Tylenol or ibuprofen, and improvement in respiratory symptoms. If employees learn that someone that they have had close contact with is positive for COVID-19, they too may be tested at Grand Itasca. If they choose not to be tested, the recommendation is that they self-quarantine for 14 days after that exposure. Because healthcare workers are inevitably exposed to patients who are suspicious for COVID-19 or eventually test positive, our staff wear proper personal protective equipment and are only tested if they become symptomatic. If they are tested, they are asked to self-quarantine until testing returns, which is generally within 72 hours. There is no treatment for COVID-19, and most people with COVID-19 have a mild illness and can recover at home without medical care. If you are sick, please stay home, and if possible, self-isolate in your home. Get rest and stay hydrated. Take over-the-counter medicine such as acetaminophen to help you feel better. If you develop emergency warning signs such as trouble breathing, seek medical care immediately. Navigating employee illness and return to work in this COVID-19 world is no easy feat. We run through these various scenarios daily, and it can be confusing even for those of us that do this often. We hope that by sharing some of our practices, that they may help you as you make decisions about your workforce. We frequently refer back to the CDC website for guidance when working through these cases as they come up. If businesses have questions about any of these recommendations, they may reach out to Jay Sonder, who's our Director of Occupational Health at Grand Itasca. We're in this together, and we'll get through this together. Thank you. I look forward to any questions.
Thank you, Dr. Suler. We will turn it over to Tamara Loney, President and CEO of Itasca Economic Development Corporation.
Thank you, Kelly. I appreciate the opportunity to talk about the work that's happening here in Itasca County. Itasca Economic Development is an organization that supports small businesses throughout Itasca County and has for many years. We have obviously shifted our focus during the times in the last 6 to 8 weeks to really support small businesses through the time of crisis, especially with the stay-at-home order and executive orders that have affected many of our small businesses here. I think the challenge that faces most of our small businesses is not only do they have a real reduction in revenues, they also have a significant increase in costs that are affecting them on a daily basis. And they're also trying to adjust to the new reformed way of doing business to ensure the safety of their employees as well as the customers that are coming in their doors. At IEDC, we've provided a number of things to help those businesses through this challenge. We worked really closely with our partners at the Blandin Foundation to build a new loan program. That loan program is available for Itasca County businesses as well as those in the border communities. And we have to date already given out more than $450,000 in loans to Itasca County businesses. But that's really just the tip of the iceberg. We've been working with small businesses, up to more than 150 of those, listening to their challenges, guiding them through forms and processes on their federal and state funding opportunities, as well as really trying to help them understand how they can reopen their doors. The questions vary from how they can help their employees with unemployment benefits to how they might help their employees have a safe work environment and want to come back to work. So these things won't change. It's not something they're going to overcome very easily. And so we anticipate this challenge being ongoing for some time. And we are very, very happy to report that the community has been extremely supportive of the new type of businesses that many restaurants and retailers have had to come up with. So we appreciate all that they've done and hope that they continue to do that through this trying time. They know that once the stay-at-home order is lifted, that it won't mean business as usual. And so they're making plans today to try to help ensure the customer safety as well as their employees. So at Itasca Economic Development, we've developed a website, we've done Facebook posts, and we've also done weekly meetings to support the business operations. This week we'll have our meeting on Wednesday at 1 o'clock, talking about how small businesses can use social media with their sales and opportunities for their customer base. So we're here to support, and we'll continue to be here throughout the crisis and far beyond. But we really encourage small business owners to reach out if they have any questions or concerns. And we really encourage the communities to continue to support those businesses through buying gift cards, ordering takeout, and really trying to do what they can to support those through this difficult time.
Thank you, Tamara, and I will turn it over to Bud Stone, President of the Grand Rapids Area Chamber of Commerce.
I think I'm unmuted now. Thanks, Kelly. I have to kind of reiterate or copy what Tamara just said. We're traveling the same roads a lot of the time, Tamara and I, and the business community has taken a pretty good hit because of the COVID-19 crisis. My perspective is that when we think about our businesses, we need to be conscious of the fact that we need to, number one, be respectful of each other while we're in our businesses and while we're going about our business, and have patience with other shoppers and also with employers and their employees. For our businesses, you know, they need to adhere to the Center for Disease Control guidelines. Much as Dan said earlier, it's expenses for sanitation issues and things like that that we are not accustomed to at this point in time. Want to make sure that we're talking about that. From the business's point, we have two customers here. We have our customers that buy things from us, and we also have our customers that work for us. There today is a shortage of employees in some sectors, especially in the grocery industry and in the food service industries. And we need to remember that as our businesses reopen, we have to repopulate those positions that in some cases were laid off and people went and found jobs in other places. I would suggest that businesses to make sure that they post both internally and externally signage regarding their expectations and responsibilities, not only of the employees, but also restrictions on entry and movement around the business for the visitors that are in those businesses. It's going to be a critical time, and as we go forward with that, the Chamber of Commerce is working not only locally, but also with our state Chamber of Commerce and with our county and city government to find ways to circumvent these issues as best as possible. And so I would say if people have questions about the business community or the things that are available to them, they can check in with the IEDC website. They have been able to develop an extremely valuable COVID page there that lists all of the resources that are available for businesses as far as funding mechanisms to help them flow through this very, very trying time. Thanks, Kelly.
We'll now introduce Ben DiNucci, business owner and Itasca County Commissioner.
Thanks, Kelly. This is a difficult time of year for this event to happen for a lot of small businesses. A lot of small businesses struggle through the winter months with snowbirders being gone, a large heating bill, and a decrease in tourism and traffic in their areas. So they struggle to make it through the winter, and with the pandemic happening here, it has just made things harder for businesses in that when spring rolls around, summer rolls around, people start returning to the area and moving through. It brings in more business, and businesses really rely on that money, that income flow. When you add to that idling of mining operations such as KeyTac, discretionary income for steelworkers becomes less. So there is less spending going on, as well as those mining companies are supporting supply and logistics chains here locally, and that comes to a halt as well. So there are some tough times ahead. We thank and support our partners at the IEDC and the Blandon Foundation. We are directing people to them. We are trying to get business owners connected with resources, and we applaud their efforts in doing that. And at the county, at Itasca County, we are receiving communications from business owners, and we are answering questions on property taxes, etc. And we will continue to do so. So we will get through this and be stronger when we do, and we'll keep working together to continue to support each other.
Thank you, Ben. At this time, we will turn it over for question and answer. And again, we ask our media to put your questions into the chat box, prefaced by your name and the organization that you represent. And we will have the panelists respond as appropriate from their facility. I did receive some questions prior to this, which we will address first. They are from Renee Pasal at WDIO. The first question was related to new cases at the Emeralds, which is our facility that the Minnesota Department of Health has recognized as having cases. We were able to clarify this with their administration this AM. There are 9 positive staff and 9 positive residents. Is there plans in place to isolate the positive patients? All positive staff and patients are isolated, and they do have staff available to answer more questions from the Emeralds, and I will put out their phone number, which we have received permission to give out, particularly in our COVID-19 information line. It is 218-326-3431. The final question was, what are the CDC or public health protocols if there are positive cases? And we interpreted this question a couple different ways. The first one was what Dr. Sular addressed, which was the recovery period. When can you return to work? So I will refer back to his information for if someone is positive and making a decision to return for work. As far as facilities, we also looked at the question from that perspective. There is Minnesota Department of Health guidance for long-term care facilities available, and the Minnesota Department of Health does assign a staff to work directly with facilities if there is an outbreak. The guidelines from the Minnesota Department of Health do include isolation and quarantine, the use of personal protective equipment, visitor and activity restrictions, disinfection and cleaning, and then there are virtual facility infection control assessments, and then monitoring and screening of employees. And this information is available on the Minnesota Department of Health website. Moving into the chat area, we have Jennifer from ICTV. The rumor is the courthouse is opening next week for paying of property taxes. Is that true? The courthouse will open solely for property tax payments, and I can respond to that again. I'm going to look up the actual dates, so we will come back to that. Kathy from KOZY, how many of the total positive COVID cases are from long-term care, total employees and patients? Yep, that's, I believe we just answered that one. Beth to ICTV, over the weekend, there was a surge of people to the businesses that were open, like hardware and big box stores. What is public health doing to help them manage these large numbers of individuals in their stores? The business, well, Tamara or Bud, this question is for public health, but is there any communication I just want to throw out with either of you to some of the big box stores?
I think you'll see that there's a number of big box stores that are starting to take a more aggressive approach to their clientele. I think the most recent was not in Itasca County, obviously, but Menards has now required guests coming in to wear masks. There's certainly a lot of stores right now that have the 6-foot rule in place. They have one-way aisles in place. I think the greater challenge is that because they are putting these pieces into place, and the numbers of customers they have is so high that they don't necessarily have the team of people to essentially police the customers. I think that's more of a social culture that we're facing. But I think you're going to continue to see some of those practices grow with other bigger box stores requiring some more safety measures to put in place and putting that back on their customers to take care of. But I wouldn't say that there's any requirement. You certainly know that the masks are a recommendation. They're not being policed right now. So there's certainly some social pressures, I think, that will help some of these stores to take on more assertive actions, but it's not a requirement.
Thanks, Tamara. And yes, from a public health perspective, if the businesses reached out to us, we would provide similar guidelines. However, we do leave it up to the businesses to access that, or we will provide them the information from MDH or CDC. So I'm going to jump back to the property tax question. May 13th, 14th, and 15th, the courthouse will be open for property tax payments. There will be a single entrance to the building. Renee from WDIO, of the 22 cases, can you share which ones have recovered? Are there any in the hospital now? We do not have the detailed information of the cases at this time. Britta from the Herald Review, how long is the wait time between testing and tracing back to how the positive cases contracted it? The Minnesota Department of Health is conducting the case investigations. To my knowledge, they're within 2 to 3 days. That is my understanding. If it's longer than that, I would have to ask that information specifically from the Minnesota Department of Health. Of course, as the cases continue to grow, their need for additional staff and response time could shift. Heidi from KXC, will all employees, patients at the Emeralds now be tested? That is a decision being made by the Emeralds with their administration and their medical director. So I would defer that back to them. Renee from WDIO, are public health or providers assisting at Emeralds? So the Minnesota Department of Health has assigned staff as per protocol to assist the Emeralds in working through this. And yes, our public health team is involved. We communicate with them very frequently, both myself and other public health staff, as we move forward. And we certainly are invited to be a part of the Minnesota Department of Health telephone calls with the facility as well. Kathy from KOZY, how many investigators are assisting the area? I do not have the answer to that. We will actually receive an update late in the day today from our local public health association and the Minnesota Department of Health on the contact tracing. So I will have more information by the end of the week. Beth from ICTV, with the governor's allowance of retail to open with curbside delivery, is there any indication of which Grand Rapids retailers are going that route? Bud or Tamara, do you have sense of which retailers are working on opening within the next short period of time?
Bud, I can answer this, or if you have a perspective to add to it, we can maybe team it a little bit. I think that from my perspective, we've been working with a number of retailers that are planning on opening with the curbside pickup. I think the challenge, as you probably know already, that there are many retailers that are smaller that don't have an online presence, so they're having to get really creative in how they can do that curbside pickup component. But we have already seen some downtown Grand Rapids doing that, and we're working on putting a list together for our website of those retailers that are open here in town. Many people have been working through appointment settings and things like that, but we're really hoping that these retailers will have some templates in place and processes to help them through this time, because it's certainly not an easy piece to do for many of our smaller retailers.
I would agree with Tamara that it's not an easy thing to do. There are businesses that are going to have an easier time doing curbside delivery than others. And some of the conversations that we've had with our businesses are that I'm just going to wait until I can really open my doors. And they're using that time and preparation to be sure that they are ready to follow the CDC guidelines and best practices to make sure that they have a safe environment, not only for their customers, but for their employees as well. So there doesn't seem to be a pattern there, and we don't have a list of those businesses. But as Tamara said, it's going to be a gradual process. And I think by the 18th of May, we'll have a little bit better idea.
Yeah, and I think we should add to this, just so everyone understands, that many of these small businesses are being told to apply for PPP funding and different mechanisms. And there's a lot of requirements on putting your employees back to work in order to have those funds forgivable. So a lot of businesses are trying to understand how to best utilize the funds that they have access to and still ensure that they're forgivable, because many of these small businesses cannot afford to take on new debt. They're really trying their hardest to sort of hang on through all this without carrying new debt into the future. And then I would also say that the other part of that is they're trying to understand, as Bud indicated, what does it look like for them when they open, and how do they get their workers back? Every business, I will tell you, every business we talk to right now that has laid off employees are very worried about getting them back, partially because they found other jobs, partially because of the $600 extra unemployment benefit that they receive. So those are very, very real issues for them, and we don't really know how they're going to overcome some of those challenges.
Thank you. We have two more, and I'm thinking that's all we will have time for. Britta from the Herald Review, with an increase in people coming back to the area for resorts and back to summer residences, at the same time people are hoping things will open up. Do we need to be more vigilant and careful? Especially as cases are increasing, we've had low numbers and people are anxious to start getting back to normal, but it seems we need to start being ever more careful. Dr. Suler, do you want to address that?
Yeah, I can take that, Kelly. Certainly, we have been blessed by having low numbers. However, as we've been discussing over the last 10 to 14 days, our numbers are certainly increasing in the area. Despite that, a lot of people are having isolation fatigue, but we still encourage people to practice social distancing, do everything they have been doing in March and April, continuing into May. The worry and what we're seeing is already a couple of our cases are tied to travel from the Twin Cities. And so we know that if people do become a little bit lax on what they should be doing at home, we will see an increase in our numbers locally.
Thank you. And our final question, Heidi from KAXC, clarification from Dr. Suler. Is social distancing in off-work time expected of employees? I think you already mentioned this, but curious about how you are working with your employees over the seriousness of this pandemic. And perhaps Angela might want to chime in from Big Fork. Go ahead.
Yeah, so I can clarify, absolutely social distancing, not only at work, but in our personal time away from work. It's interesting that question came up. I send out a daily update to our providers, and that is going to be in my update with the nicer weather, with fishing season around the corner. We certainly are role models in the community, and we need to take this as seriously as what we're preaching. And so, without a doubt, social distancing at work, at home, is absolutely still vital to keep this under control.
You're muted, Angela.
Can you hear me now? Yeah, thank you. We've kept in communication with our staff via email and also developed an internal website for our staff to update them on any information that we're changing within the facility, and are also asking all of our staff to abide by the stay-home order, maintain that social distance, keep the mask on when they're in public. Of course, we've established universal masking within the facility, but that is going to be crucial to maintaining these low numbers.
Thank you, Angela, and thank you all for participating in our virtual press briefing today. We will be hosting another press briefing on Friday at 10 a.m. and the focus will be on law enforcement. Thank you and have a great rest of your week. Stay well.